Now all this time I've been in an awful lot of pain. I've been increasing painkillers all the way up, and I'm on quite heavy painkillers. I mean, I started on amitriptyline, I went up to gabapentin to full dose. Still the pain. So all this time I haven't been able to return to work because of the pressures of it. And the pain eventually started to pull me down. And I'm thinking, this is positive, it's going to live to be 100. Why am I still hurting? Is my cancer still there? Is there something I can't see? Is it going to kill me? And I started to spiral down. I didn't realise this, but I was going to Laros at the lymphedema clinic because through the various things, I haven't had a lymphedema, but I had a bit of a little bit of swelling above the breast. So that was just being kept an eye on. I went to see her at Laros and I spent the whole hour crying, telling her pretty much my life story of my pain. I went to the GP and I was crying in front of her. The Macmillan nurse came, same with her, and I think between the three of them they all said, you should have a bit of counselling, you are struggling. I'm the sort of person that thinks counselling, what a load of rubbish. Go on, I'll give it a go.
So you were quite sceptical initially? I
was. I mean, as I say, I deal with, everybody comes to me in the family. I'm a bit of a team leader in the family, I think. I'm the mother figure. Everybody comes to me with a little problem. So I couldn't see I'd got one myself, and in the end, as I was told at my counselling, I was protecting myself and protecting everybody else with this shield around me. So I started the counselling, and I explained that I have fears of death. Cancer to me meant death, and just saying that had me sobbing. As you can see, you know, I can say it now. I had quite an intensive, I had 16 sessions altogether with Jules at Laros. Wonderful lady. I said to her, I don't know what you've done, and she said, you've cured yourself, but I said, I know you know where to pick though. You've pulled the little things out of me that I need to talk about. I went there originally with what I call a bucket list, which a lot of people say now, things to do before they die. And through my counselling, I have now got it as a life goal list. Still the same things on it. Going to China, I want to walk the wall. That is my main aim in life, to walk the Great Wall. We set that for 2014. However, my son's now told me he's marrying in 2014, so I may have to put that off by a year.
So you prefer the idea of a life goal list?
I do, because
bucket list.
Yeah, I think I've worked out that my pain is not cancer, or I don't think it's cancer. The pain is caused by this implant. Mr. Cooey has agreed that maybe I'm one of those persons it doesn't suit. So I'm now on the list for a reconstruction to have the flap from the tummy tuck and the breast, which I hopefully get after Christmas next year. So although I'm on a lot of painkillers still, I'm still in pain, I do see an end to it. And through my counselling at Laros, and then with Sue, because that's a funny story. Halfway through my counselling, I was getting stronger, and I explained to Jules that when I go to the oncology suite to see Dr. Osman, which I've seen every third Herceptin, I never seen Dr. Osman, I always seen a different doctor or a registrar, and I'd go with my list of questions, but I found I was in tears before I could get answers to them, and I'd walk out and I think I found out nothing here. So Jules suggested I write to Dr. Osman. Oh, no, that's scary. No, she says, you do it. He's your doctor, he's there to help you. So I spent 2 weeks and I wrote a letter and I explained that I was in a lot of pain and I couldn't work out if it was cancer, if it was the implant. Could I talk to somebody? I needed help. Anyway, the next time I went, the nurse come and fetch me and she says, you're seeing Dr. Osman today, that's a treat. You don't see people like you very often, so I'm thinking, uh-oh. And I walked in and sat down and he said, hello Deborah, are you all right? And I says, yes, thank you. He says, "Are you sure?" "Yes, thank you." "Did you get my letter?" And he said, "Yes, thank you." But he sat with me for 20 minutes, half an hour, and he talked through everything I'd wrote. And he said to me, "Would you talk to somebody from my team, psycho-oncology?" I said, "I will talk to anybody if they'll help me." And he recommended Sue to me. So I was seeing Sue and also still seeing Jules, but they were working with different areas, so they could work together. So between the two of them, they've pretty much put my head back on.
What's it like looking back on that time? Because you were somebody who were sceptical about asking for help. Now
I think, wow, I can see what she's done for me, as I say, and Sue is still working. I'm pretty much there. I still fear cancer, and my positive thoughts of living to be 100, which was my life goal. I say, well, I've had cancer, so maybe I won't, but maybe I will, you know. So
you've still got that.
My positive, my cup is half full again, instead of it would be. I mean, I was so down. I didn't realise how low I was. People would come in and say, "Are you all right?" No, you know, and I really couldn't cope with what I was dealing with myself. I put weight on, which is bad for yourself. You know, you lose your self-confidence. You lose who you are. You suddenly become this person that's being taken through it all, which when it happens is fine. You're going through this routine of an operation and chemo and operation. You're under an umbrella, and suddenly it stops. And I think it does cause a panic. You suddenly got nobody that's looking after you, and you think, well, will it come back now and nobody will know? So through the counselling, it's taught me to lift myself up and think positive myself. Coping with cancer also, I've discovered that. That's
because that's in the voluntary sector there.
That's right.
They offer additional group therapy.
Yeah, there's one
sessions
in Colville at the Marlene Reed Centre, and a lady I met on my first hospital when I had my mastectomy. I met a lady who was having a lymph node clearance, and we've stayed friends throughout. We've had pretty much the same treatments throughout, and it's been quite good to meet up with her every 2 months or so, and we have coffee and cake, and then we've started to do this coping with cancer together, and it's quite good just to sit and have a talk, although I'm not into the group thing. I prefer a one-to-one, but it's nice to go there with Janet, and we sit and we talk, and we're going to have a little bit of complementary therapy, and it's quite nice.
Do you think it's important to meet other patients who've been through some of the things?
I like to talk one-to-one. I think, you know, I'd offer to talk to somebody one-to-one, but maybe not in a group. That doesn't really appeal to me.